Well, there weren't a lot of choices when we started looking 5 years ago, or probably it was before that, maybe 6, 7 years ago when we started looking. And you know, the options that we have, some were too expensive, and we just couldn't afford to do that. Other options, they just didn't have enough meat and potatoes. They didn't have enough options for us in terms of what we wanted to do with it. And there were good charting applications out there, but they didn't integrate the billing software with it. So we wanted to be able to combine the both things together, and that's how we ended up with e-MDs. Because we're multi-specialty, it's nice to be able to tracking board, for instance, that you can kind of look at the clinic at a glance and know how we're doing overall, to be able to know where, you know, who's busy, who's not busy, where we can try to get the most customer convenience for our patients. The other thing that's nice is that the chart's all in one. So even though I have different people seeing the patients, you know, as a family doctor, I can know what the pain management doctor is doing. I can know what the gynecologist is doing. All the records are stored just in one chart. Well, certainly our notes look a lot better, that's for sure, than a handwritten version. I think they're a lot more complete. They're a lot more accurate. And we incorporate all the things that you do review when you have a patient come in, saying their past medical history, their allergies, surgeries, all that kind of stuff. You have it automatically imported into the note. I think we bill better now because we've got the E&M coder that's there and prompts us to probably bill more reflective of what we should have been, whereas maybe we weren't billing high enough before. The other thing that's great is the rules manager, and we use that a lot to prompt us as to what preventative measures might be upcoming for patients. And you know, that's a great thing for patients. There's lots of people that slip by that never get their preventative stuff done, you know, because they'll come in for a cough or a cold, but they won't, you know, get their physicals or have their prostate checked or that kind of thing. And you can really kind of flag that very well with the system. Probably the main thing that we noticed when we first, from before we started to when we went fully integrated with the whole software, we probably saw about 250 patients a day. And then maybe 6 months afterwards, we went up to about 350 patients a day for the whole clinic. And we did that with probably missing 3 full-time front office staff, mainly medical records people. So we were able to see more patients with less support staff for us. We're actually just about to open up our first satellite clinic in about 2-3 weeks from now, and plans for a second satellite clinic probably within 6 months. And it's going to be great because we can have one database. A patient can go to any 3 locations instead of just having to go to one, because their information is going to be at all locations. And I think that's going to be a great tool for us to give to our patients. Support has been great. You call in and they make a ticket for you to try to resolve your problem, and they do follow through and they get back to you. Sometimes it's not as quick as I'd like. Sometimes I'd like my answer to be taken care of right on the phone, instead of, you know, creating a ticket and following up at a later date, especially if it's a simpler problem. But oftentimes they're quite complex things that you guys need to get our database for and try to research the things, so I understand that, you know, it takes a little bit of time to be able to research that. But they've always gotten back to us. We're able to create a lot of reporting now that we were never able to do. We utilize crystal reports a lot for that. We're able to kind of flag people that might be due for certain measures and either send them an email or a postcard or what have you to remind them of certain things. And obviously there's a financial reward for that to your practice. We're able to work from home, which is a great thing. So when you're done and you know, your kid's got a baseball game or whatever, you can just zip out of there and finish up your charting or reviewing your records and that kind of thing at home. And as more of my role as a medical director, I can be still watching the practice from afar, even though I may not be there, which is a great thing for me too. So I would encourage people to talk to somebody who's already gone through the process, because it's daunting. You don't really know where to start, and I think it's really important just to set a start date. You know, just like if you were going to quit smoking, you got to set that date and stick to it. It's very tempting to go back and try to hang on to those paper charts. You just don't want to give them up. But you know, I'd encourage them that it can be done. It's going to be painful, and you're going to have to you know, decide how your flow, how you want it to be. And with the e-MDs, I mean, there's so many different ways that you can integrate the system. You know, customize it to your own practices that you have at your office. But you know, I think the best thing is to just do it and not look back, and you won't regret it. You'll never want to go back to your paper charts again.